Hey everyone, it's Molly the Kush RN, your cannabis community correspondent and host of Conversations with Kush podcast. Once again, I am sitting down with this woman. She is the winner of our raffle, Miss Tricia Brown, my good friend and cannabis nurse extraordinaire. Tricia, welcome back to the show for the 17th time. I was like, there can't be anything more we can talk about, is there?
I'm the L. Roker of when he
I love it.
L. Roker back up on Conan O'Brien. He would always show up.
Oh, man. Yeah, totally. That's who you are in this space.
He was definitely at about 17 times. I'm probably at 4, maybe.
Yeah, 4 or 5.
visits.
You know, it's always a pleasure, though. I always enjoy having you on.
And I enjoy talking with you.
Yeah, so I wanted to say one thing about you. I was sitting at Earl Giles the other day, and there was like a recap going on of CanMed, and I got talking to Angelique and Ghislaine, and you, with so much poise, the thing that I love about you and the thing that I really see as shining through as leadership is you will go and talk to whoever sits down. You go over, you speak to them, you get to know who they are, what they're doing in this space, and I just think that that's a really invaluable skill. I think it's hard to kind of put yourself out there sometimes, but you are just such a firecracker and so nosy. But
I like to have fun.
Yeah, you do.
Let's
yeah.
just face it.
Yeah,
Life
you do.
is short.
Yeah.
And I think it was Keanu Reeves said, live your life, have fun.
Yeah.
Something. That's not a direct quote. Sorry, Keanu.
He's like definitely a person I would want to smoke weed with, right? He's like on my list of 3. Yeah. Who's on your list?
Oh my God, I smoke. There's
Jesus.
That's a
Or
very
the
good
devil.
question.
Yeah.
I would like to smoke it more with my parents
Okay.
before they pass.
Yeah.
That would be number 1. My mom had a good experience last time I was home, by the way.
Nice.
I like Woody Harrelson.
Yeah.
I don't want to miss anybody. Matthew McConaughey, maybe?
Seth Rogen.
Seth Rogen.
I was out in Oakland or Berkeley a couple of days ago and sitting down with Dr. Harold Hahn, and they make Seth Rogen's drink for him. Vertosa does. So, yeah, we enjoyed a couple of Seth's drinks, and, yeah, it was a good time.
I'm sure that was delicious.
Yeah, it was.
His drink? What's it called?
Oh, shit.
That's okay.
Don't quote me now. Sorry, Seth Rogen. I said it was amazing, and
Help
it was.
us out, Seth.
Yeah. Help us
You have an
out.
opportunity
Be a
to
friend of
come
the
on.
podcast. Be a
Yes.
friend of the podcast, Seth. Come on down. We're
Come
ready
for
for
your
you.
interview. No,
So-
I want to compliment you too, Molly.
Oh.
You always make me feel comfortable.
Oh, Trish.
And your voice is velvety, and you have great interview skills. And you
Oh.
are a freaking trailblazer as a nurse, putting yourself out here as a podcaster.
Yeah.
Well done.
Thank you.
Well done.
Yeah.
This is a hard field to be in when you have a license.
Yeah, totally.
Skate on thin ice.
Yeah, and I don't have a license, thank God. I always say I'm so happy that I did not pick a business that is plant touching. So here we are, right? Yeah. But you're talking about my nursing license, of course, right?
That's
Yeah.
okay. Yes, I don't have a license either. We don't have licenses.
Yeah, only as nurses. Only as nurses in a couple of different states. Do you have a
Yes.
Wisconsin license?
No,
I
didn't
do.
Keep it.
Okay,
I
yeah.
should have.
Yeah, it's
Gosh.
really easy to get, actually.
Really?
Yeah.
If I renew it?
Yeah,
you think?
totally.
'Cause they're compact.
No, they're really easy to renew with,
Okay.
actually, yeah.
Well, and since I have a history, I should be able
Yeah,
to get
you
that pretty
should.
easily. Yeah, maybe I will.
Wisconsin girl,
The
come
Midwest
on.
is slowly evolving
Yeah,
to
it totally
cannabis,
is,
so,
yeah.
Yeah.
So
that'd be
what's
a good
been your
idea.
observation about our market so far? What are you pleased with? What are you maybe not as pleased with?
Well, I'll just bring up, for example, we had NECAN last month.
Yeah.
And
Hey,
some of the
NECAN.
there was I don't know if it was a vendor or visitor, but somebody had commented on social media and they were not impressed with our flower at the moment. They didn't say where they stopped, but also that there was a big piece missing. There wasn't a bud tender that was able to help them with their questions. So
Okay.
education gap in general, though, is missing in this state and in the cannabis nationwide.
Yeah.
Everywhere we need education, and I think
How are
we're really
you-
good at filling in that gap.
How are you hoping to fill in that gap?
So as you know, 3 years ago I took a certificate program, so a Canny Nurse certificate program, which really prepped me to be in the space of guiding medical patients, but I couldn't do anything with that. The Office of Cannabis Management here in Minnesota endorses 3 programs. So I took one of their programs, which is giving me a certification, Certified Medical Cannabis Consultant, and with that I can actually guide patients. So I'm really hoping to partner with medical dispensaries to guide patients and provide that gap that's missing in education. And as you know, nurses are the most trusted profession for 23 years in a row. I feel very strongly about the benefits of cannabis, and with over 30 years at the bedside, there isn't one person really in my career out of thousands of patients, all adults, that I don't see could benefit from cannabis.
Right.
Cancer patients, Alzheimer's, dementia, heart conditions.
Or even bolstering their own endocannabinoid system. If you don't want to try cannabis, at least do the things that are going to be good to your ECS,
yes,
right?
100%. So as a nurse coach, those would be things that I would address. I don't know if I can do that in the role of a CMCC because of time constraints. So I can wear a couple of hats in Minnesota, cannabis nurse coach or a CMCC. CMCC is a little bit more limiting, but it also allows me to guide. The nurse coaching, I have a broader range to reach because I can coach adult use that don't want to proceed on with the medical route. So,
why do you think it's important for CMCCs to be nurses?
Well, nurses have patient care experience with a multitude of diagnoses and conditions. We also know how to speak to doctors and pharmacists, and we know the chain of command in the medical system. Nurses also spend the most time with patients, that therapeutic communication, non-judgment. There's no stigma if you're talking to a nurse. And we understand where you're coming from. A lot of people turn to medical cannabis because they've exhausted all other means and they're looking for something else for relief. And the highest demographic is, I hear different numbers, but 45 and up. I've heard 50 and up. And they just need that support to know that there's a nurse there to guide them and to teach them how to document their experience, to journal, I know as a CMCC and having my certification, because my education has come from experts in the field like Dr. Dustin Sulak, Dr. Bonnie Goldstein, and Dr. Ethan Russo. So they have already kind of figured this out with their own experiences, how to dose and guide and manage patients, and how to, if you're working with a nurse who's also a CMCC, you're less likely to develop a cannabis use disorder. You are going to be more or less likely to develop CHS, which is cannabis hyperemesis syndrome. These things can be avoided and prevented if you have the proper guidance. I really do believe that, and I think Minnesota has an opportunity to really make a difference in this space, because if you're having a clinician working with medical patients, they're going to teach them how to use the medicine with intention, and always start low, go slow, and stay at that sweet spot.
You know, and a bud tender or a CMCC can certainly make those recommendations, but what do they do when the regimen that they suggested doesn't work? How do they know how to pivot? How do they know what to be cognizant of the medications that the patient's already on, and could there be drug interactions if they have a specific condition and, you know, they have specific symptoms? It's very personal and vulnerable to have to go into a dispensary, talk to a CMCC, and maybe they don't have any medical background, and now you have to tell this person about your IBS. Like, right?
Exactly.
Yeah. So,
and not only that, what resources do they have?
Right.
So you and I are part of the Society of Cannabis Clinicians.
Right.
That's an opportunity, if there's something that I'm struggling with, that I can reach out and we can have a case study discussion.
No doubt.
That's just one thing. And then the other part is staying up on top of research. I don't know that there's anything in place to guide CMCCs in that role, but it's very layered and complex. And I was given a list of possible medication interactions, but I know also how to go further with that, and that was not offered. There's a lot of gaps. I think it can be done with proper training, but I think a nurse overseeing the program or being the liaison or a clinical director of a dispensary, it's going to be a lot more successful if we have that chain of command, speaking with doctors and psychiatrists and the gamut.
Exactly. People need that support, that extra support. As nurses, I feel like we're the translator of what the patient wants and where they're at to the clinician, right? And we go back and forth between those two spaces, and we're the trusted person. We're the person that's going to keep your healthcare information safe and not gossip about it or spread, whatever you've told us out to the world. Like I feel very strongly about that, about, patients that I've encountered that maybe even have been friends. No one else knows that they've been my patient.
Right.
Right?
Yeah.
So, that's really critical. I mean, we have these ethics that we have to really stand on. And again, I heard something the other day that said cannabis is personalized medicine. And it made so much sense to me, because every person is going to need their product that works for them. They're going to need the strain that works for them. They're going to have the symptom management that needs to come about, right? So it is very personalized. And to have that guidance when you first go in, that's great. But what do you do when your symptoms aren't managed and you need to come back, and how do you pivot? And so these are things that nurses are skilled in doing. We evaluate care plans, and so that's what it is. When you go in to talk to a CMCC, it's your care plan.
Exactly.
This is what you should look for in your products, and maybe think about taking it at these different times. We are there to help you navigate through those things. If you're waking up the next morning and you're still feeling a little groggy, then we know you need to take your medicine a little bit earlier. An hour or two earlier to kind of off-put that, right?
Or cut it back a little bit.
Or cut it back,
exactly.
Right.
Yep. There's so many things that need to be considered when you're working with medical patients. Their age, metabolism, polypharmacy, if they've had prior experience with cannabis. And like you said, it's just super individualized. So what works for this 80-year-old woman and her twin sister could be different, because her whole endocannabinoid dome is different. Their system, everything. We have the receptors, we have enzymes that break them down, and we produce our own endocannabinoids. So our sleep impacts the function of our endocannabinoid system. Our diet, which is also one of the biggest predictors of health, can impact our endocannabinoid system. Sleep impacts it, and then you have a plant that can actually help you sleep, so then you're also helping tone up your endocannabinoid system to function better. Stress, inflammation, social relationship, it is a connector. And with my years of experience, which isn't huge in the cannabis space, but 3 years, we'll leave it at that, it could be longer, it really connects the mind-body experience. It's mind-body spirit, experience. I really believe that.
One of the things that we heard at CanMed was there was a lot of talk about sleep, actually, and how if you can fix a person's sleep, usually that's going to mean that they don't need as much cannabinoids during the day.
Yes.
Right? Like sleep really, it hinges on everything. Like everything you do depends on how rested you are, how your brain is able to function, how you show up, how your mood. It's such a balance. If people can just get good rest, it's really at the heart of it.
It's all part of healing.
Yeah.
If you're not sleeping, your body needs to rest. It needs to recover. It's good to go to bed on an empty stomach, by the way, because otherwise the energy is going to the gut and metabolism and breakdown of food.
That food. Yeah.
A lot of factors, but yet also simple lifestyle practices too to help really enhance your endocannabinoid tone. So just fluids, getting outside in nature. And part of my role as a cannabis nurse coach would be really to work with patients, clients, and creating SMART goals that address nutrition, exercise, stress management, social relationships, and sleep. So it's not, it's a holistic approach.
Yeah.
Cannabis is a tool to health and wellness, and that's, as a nurse, that's how I want to help support people on their road to better health. But as a CMCC, I'm a little bit limited in that role. But
sure.
I am available to teach at dispensaries,
Hey.
either way, adult or medicals. And that's how I've been filling the space. Green Canopy's been super supportive, having me there for classes. Herbs and Herbs, Alicia Bellamy.
Yes.
If I'm forgetting somebody, I'm sorry. I've done some education with a qualifying nurse practitioner, Lindsay Smith.
Yep.
I don't say her name. Mary Jane Consulting.
Mary Jane Healthcare.
We taught cannabis and HIV. And yeah, I just want to get to work. I'm getting.
Yeah.
I'm sure you are too.
I do
like,
too.
let us help
Dispensaries.
you.
Hello, we're
I know,
here. We're
I'm getting
here.
burnt out. Can I just work with patients?
Yeah.
So let's make it successful in Minnesota. This is an opportunity now. Hemp has a place. Cannabis has a place. There's so much anecdotal evidence out there. I've met so many people in the space that have stopped drinking because of the beverages. They're sleeping better from hemp-derived edibles. I mean, you name it. They're considering becoming shamans because of their experience with cannabis. And we heard beautiful experiences of healing at CanMed with the veteran Gary. I can't remember his last name.
Gary Hess.
Yes, it saved his life. Mm-hmm. And now they're talking about ibogaine, which is just incredible.
Yeah, you know the SCC has something coming up on ibogaine that looks really interesting.
September 4th, I believe.
Yeah.
I'm going to sign up for it.
So one thing I just want to really invite the industry to consult with nurses. We know what patients need as medicine, and we can help you do product development or, just really help in understanding what those things are that patients need. So that when you are doing product development, you have a better idea of what might sell. And I think that there's value in even just having a nurse at your dispensary for the day when people can come in and talk about their medicine and cannabis as medicine and what needs are going unmet through cannabis and how that gap can be smoothed out. So hey guys, here we are.
We're here. We are here. We want to help.
Here.
We want to help you succeed.
Yeah, we do.
We are your friends.
Yeah, for sure.
The other thing that you brought up too, Molly, in addition, we know what patients want. That's huge. Whether they're coming in for adult and have questions, I already know where to start. What type of chemovars, and that's educating the client with that knowledge, but also you as retail owners. We know what patients are looking for, what types of medicine that they want. And high THC is not the way to go. It does not make it a better product. In fact, you're going to have more side effects and more potential for psychosis and addiction. High THC is not better medicine. We're finding more evidence to support a balanced THC CBD for chronic pain. But once again, it's very individualized. And if you're fearful, we were talking about, you start low, go slow. Some people start with just a CBD, and let's see how that works. And then you slowly add low doses of THC, and you start at night so that you're less likely to have a fall or you're going to sleep. So starting THC at nighttime is a great beginner method to begin, but it really is so complex, but it's simple at the same time.
Right. And another thing that I just want to invite is that most people aren't going to want THC. They don't want to feel high. The people that are new to cannabis, everybody has their way of consuming, and there should be no judgment as to what that is. My ask is only that you think about using your cannabis in an intentional way. So I have a story of a friend who's taking a tea break, and he was talking about all these emotions and things that he had been suppressing really or numbing out with cannabis. And he's he's learning a lot through his tea break, and I'm like, that's amazing, and I hope you tell your story more often, because people need to know that sometimes maybe you just need a little reset and understand why you are consuming this plant and what it does for you and what else it can do for you, right? So
exactly. There's so many conditions out there, and what's cool, the Office of Cannabis Management in Minnesota, there's over 20 recognized qualifying conditions, but if you have a conversation with your healthcare provider, they can recommend cannabis, and then we do the rest. We find the qualifier, and I know they're putting the feelers out there, reaching out the big hospital organizations to find doctors who are qualifying. They're getting their ducks in a row, and Molly, there's plenty of us around here, myself, other nurses are here to help that doctor put some trust in the system as well.
Yeah.
We've been in healthcare for combined over 60 years, and we really do care about patients.
Yeah.
And it's not just about the high, it's about healing and using cannabis with intention. And I really think it has a lot of promise as being an alternative and a replacement. And this is not medical advice, but I would like to see more people start with cannabis over a prescription drug for many
It's
conditions.
a first-line medication.
Yeah,
It's a first-line medication. That's another takeaway that I thought was really good about CanMed this year, is that we're not just talking about cannabis as a symptom management tool anymore. Now, with Schedule 3 and research opening up, we're going to actually be able to talk about cannabis as a curative measure. So tumor reduction or
helping with alcohol withdrawal.
Exactly. There's so many applications.
Yeah. We could go on and on. But
Menopause.
your doctor's supposed to help you through this process.
Yeah, right.
And if you don't know how to talk to them, Molly and I do.
Yeah, let us know. We'll come sit down with them for you.
We'll come advocate for you.
Yeah, for sure. Or we'll teach you how to advocate for yourself.
Yes.
Right? I mean,
yeah,
that's the best way. So, yeah. Last but not least, tell my audience where they can find you.
Oh, gosh. Okay. On Instagram, Cannabis Nurse Tricia. On Facebook, Centris Health and Wellness. On LinkedIn, Tricia Brown. TikTok, at Cannabis Tricia, Cannabis Nurse Tricia.
This is where you're going to see all of her dances.
Promoter. I haven't done this. I'm not on social media a lot. I'm a one-woman team right now, and I am also in my 50s and suck at technology, but I'll admit it.
Hey, we can do it. We can do it. We're in our 50s. We got technology.
And I still work. I still have my day job.
Right?
So, yeah.
Yeah. That's the hardest part for me is, like, when am I going to finally be able to transition away from the bedside? Yes. But I love my bedside job.
I do too.
Yeah, I love being a nurse. Yeah. I really do. I mean, there's days, of course, where it takes a little more to like get up for it, but
definitely,
it's you know, you connect with a patient. You're just like, okay, I remember why I'm doing this now.
Yes.
You know.
And Molly, I'm having family members asking about cannabis.
Yeah.
And I have to not give them my card, and it's super frustrating. But I have printed education on Alzheimer's and cannabis, dementia, few different things, but I cannot tell people what I do outside of the hospital.
Yeah, I know.
And they're asking other nurses too, and it's heartbreaking to know that there's this plant medicine out there that can help their loved one with their quality of life.
Yeah.
And to just help people bear their illnesses.
Yeah.
We know it can help with cutting off blood cells to cancer and cause programmed cell death with cancer cells and so many other things, but at the minimum it helps people manage their chronic disease where they can live and enjoy life and meet friends out. It's just this amazing connector.
It's not just a lifesaver, it's a life giver.
Yes. So and it lets you be fun and free and like a child again.
Yeah. And, you know, you always bring that kind of energy. So thank you for that, because I'm always, like, buttoned up, serious. And here comes Trish, and she's over here, like, making faces at me and shit. So I love the way you keep it light.
The youngest of 6 kids. I always say I'm like a teenage boy in a woman's body, but sometimes I look like a woman and act like a woman. I'm a chameleon.
Yeah, you are. Well, I just want to thank you again for your expertise, and thank you for coming on. Congratulations on winning the raffle. Yes, thank you.
I had such a great time with Natalie this morning.
Yeah.
She took my photos. I wasn't sure what to expect, and I just had to grab something that
I can't wait to see them.
I think they're going to be really good.
They're going to be amazing because you're gorgeous. Oh. So, hello.
For my age.
Hey, you're gorgeous, period.
I'm joking. I'm just having fun. And I am completely sober, by the way.
Oh,
this is just me.
Oh shit! Here, oh my gosh, she's completely sober.
Sorry to disappoint you. I'm
so
California sober too. Do you want to describe what California
Go
sober
ahead.
is? Well, it's sober except for cannabis.
It's sober except for weed.
Does that mean you had to be an alcoholic? Or
I don't know.
I wonder
too.
If that's what it originated from.
If you're California sober, are you like a recovering?
Weed. Okay.
All
right.
Well,
cool. It's been a pleasure. And
thank you.
Yeah.
Thank you for wrapping it up for me.
The North Bloom. Also.
Yes. Talk about the North Bloom.
The North Bloom is a cannabis lifestyle magazine. It's educational. It's living learning and listening, and it's Minnesota only, but we are always looking for sponsors. It won the Green State Award for Best Magazine, and our clients, our patients love it. It's in grocery stores, it's in retail shops, dispensaries, libraries, all over, and it's a great resource.
Coffee tables.
Yes, yes. Check it out, and I've written some articles in there too, and Molly's going to be writing hopefully soon.
We'll see.
And we'll see. We'll go from there.
Okay, well, that's it for this episode of Conversations with Kush. We are checking in day 1 at CannaCon 2026. Congratulations to Tricia for winning the raffle.
Yes, that's awesome.
And take us
All
out,
right.
Trish.
All right. Peace.
Peace.